You're a Democrat, right?
Yes.
Did you vote for the president?
No, I did not.
And why didn't you vote for him? On this healthcare thing?
In general. I just felt like he was a salesman and not a president.
Well, my next guest really doesn't care who delivers the message. She's just not buying it. You see, Anna Barone is a registered Democrat against government-run healthcare. She's also a registered nurse and healthcare specialist, so she knows of what she speaks. So this isn't like a Ricardo Montalban deal here. You just don't like what either of these guys might be trying to sell.
No.
Why not?
Why? If people go online and they look at this bill, they will be sick. It caters to non-citizens. You're going to have to pay $2,500 if you don't want this plan. Also, it doesn't benefit senior citizens. It doesn't benefit young people. Today I heard a doctor say that young people, they need to wake up because young people are going to have to pay $4,000. It's not going to be free. Nothing is for free. Nothing.
But the argument now is, you've heard, Anna, that if we don't do something, it's going to get worse. Now, you just heard Bill Clinton saying that in 1993, and that if we didn't do something, essentially the economy would suffer. We know in retrospect, actually, the economy did okay. So what do you make of that argument, and are we being scared into doing something, or do you think there's legitimacy to it this time?
First of all, the plan, if they pass it right now, what are they rushing? It's not going to go into effect till 2013. If you're going to get a plan through, get it right. Hear the people. The people voted President Obama in. He is not listening to the people. The American people are saying, I don't want this plan. Why are you intruding in my life?
Well, as a registered nurse, I hear from many nurses who say, if you think we're overwhelmed now, we're really going to be overwhelmed if this comes to pass. What do they mean by that?
Well, you go into the emergency room, you have to wait at least 5 or 6 hours to just eat, no matter what your injury is other than a heart attack, you have to wait. You have to wait there. God forbid it's free, or if it's universal, you have to wait in the emergency room probably for 2 or 3 days. You're going to have to go on a waiting list. We see Canada, people that are terminally ill or they have cancer, they come here. They go to a Mayo Clinic in Arizona.
But the argument for doing something, even if it's not perfect now, as you've probably heard at it, is that it's only getting worse the way the system is now. The problems you point out are getting worse now. And we're going to hit a point of no return here where the government has got to do something. What do you say?
Well, government, in this plan, if you read it, it says that the government will have your records, your medical records, not your doctor. Government will. Do you want government telling you? They're going to tell you what procedure you can have. Do you want government telling you? They can't even run cash for clunkers. They're going to run your health care system.
But the government has a lot of this stuff already. I mean, the argument for it is that the government already does have a lot of this stuff. Now you fear that they're going to start getting really personal.
The president went on TV saying it's going to go bankrupt. I mean, shouldn't we try to fix these two systems we have now instead of trying to just do an overhaul of the whole system?
But you're a Democrat, right?
Yes.
Did you vote for the president?
No, I did not.
And why didn't you vote for him? On this healthcare thing?
In general. I just felt like he was a salesman and not a president.
All right. Anna, thank you very much.
Thank you.